Okay, great. So, welcome everybody. This is our first video broadcast that you're seeing here. I'm Dr. Richard Maharaj, Clinical Director of iLabs Optometry and Dry Eye Clinic. And I'm going to take this opportunity to introduce a new segment which we're going to do as regularly as possible, answering patient questions, talking about eye news and eye-related issues, as well as clinical issues that might be of interest to you. So tonight I'm actually very excited to introduce a new member of the iLabs team, Dr. Faran Vafaie, I apologize, Dr. Faran Vafaie, who is a clinical intern with us back this past fall of 2014 and is actually a University of Waterloo School of Optometry graduate and now an official Doctor of Optometry. So I'd like to welcome Dr. Vafaie and maybe Faran, you can tell us a little bit about yourself and your training.
Great, thanks a lot, Richard. I did my undergraduate studies at the University of Western Ontario. I did my honors Bachelor of Science in biology, and I then continued to do a master's degree in biochemistry with a focus on cardiovascular research and aging. After that, I was accepted to the University of Waterloo School of Optometry and Vision Sciences, and throughout my 4 years of study there, I was able to have the benefit of receiving a lot of patient experience, especially in the latter years, and make a lot of connections with optometrists throughout the entire country, or future optometrists. I had the honor of being on the Dean's Honor List throughout my 4 years, and I was a recipient of the OSI Award for Excellence in Practice Management. And I guess this has been awarded to students in the past who have demonstrated leadership in areas of professionalism and communication skills, as well as academic standing. And I was also selected by my peers to deliver the valedictorian address to my graduating class. On our last year of study, we have the opportunity to do various externships in different clinics. I was able to complete an ocular disease and therapeutics externship in ophthalmology with Dr. Leslie Landecker in Newmarket. And it was there I received extensive training in treatment and management of conditions such as diabetic retinopathy, glaucoma, cataracts, macular degeneration. I also had the opportunity to perform pre- and post-operative surgical care for patients at South Lake Regional Health Center. I also had the opportunity to complete several primary care externships, one of them with yourself, of which I learned quite a bit, but also in Vaughan and Newmarket, and then I also did a rotation at the school itself.
Well, now that's great, and thanks for sharing that. I know obviously your time was certainly enjoyable for me, and I'm glad that you got a lot out of it. And it's wonderful with your varied experience, both within the surgical, the pre-surgical, and post-surgical, as well as in general medical management of eye disease, that you're going to be able to bring that vast amount of knowledge and energy, your youthful energy, to practice, and I'm sure our patients will appreciate it. Why don't you tell us a little bit about what areas of interest within optometry you have, and perhaps some of your specialty focuses?
Well, I think there are at least two areas that I have had or I've developed an interest for in my studies. One is in specialty contact lenses, and I think there's a few places for that. One is that the connections that iLabs is a lot of I think presents a good opportunity for us to provide patients with the care needed in terms of the specialty type of contact lenses that are required for advanced ocular conditions such as keratoconus or people who have had corneal transplant, as well as the many patients who travel from very far to come to the clinic for management of dry eye. I also think that there is quite a bit of opportunity there for management of that condition. And also, one thing that, I mean, personally, I guess I've had experience with is that, and we see in the news more and more today, is this issue of the increasing prevalence of myopia or nearsightedness. And there's a lot of interesting studies that have been done and are coming down the pipeline with respect to how can we actually control this myopia. And in the past, it's been a bit of a hoop dream, but I think there are some promising promising things that are coming forth, and one of them is in the realm of specialty contact lenses. And so I'm excited for us to start exploring the avenue of corneal refractive therapy here at iLabs. And then also, the time that I spent in your clinic, I also did develop an interest with dry eye, so I would also like to learn a little bit more about that condition, especially under the guru, Dr. Maharaj.
But that's great. Yeah, no, to be honest, I mean, I think just to speak candidly, you know, the concept of myopia and nearsightedness is definitely on the brains of our patients and our patients' parents, and myself and yours as well as professionals. So it's wonderfully exciting to be able to bring corneal refractive therapy and other forms of myopia control to iLabs. And I think our patients are really, really looking forward to that service, and I'm sure there's going to be more to come on that. So we've kind of we've talked the talk in terms of what you do and where your training took you to, and where your training was. So why don't you tell us a little bit about Faran Vafaie, the person, and a little bit more behind the white coat.
Well, I'm not wearing my white coat right now, so I guess I'll tell you what I've been doing. I mean, I'm married, and we have a 1.5-year-old baby boy. And I've developed a particular passion, actually, myself and my wife, for working with the young, and those especially in early high school, and those who are starting to think about decisions that are going to have a tremendous impact on the rest of their life. And so, just really, we've developed an interest in working in neighborhoods and helping the young see how they can contribute to the betterment of their neighborhoods, and that's actually helped me travel quite a bit. Trying to learn about this. So that's kind of my, I guess, non-paying work that I do. But in addition to that, I love to watch movies. I love to play board games. I love long walks on the beach.
Oh, well. Well, anyways, thanks for taking the time, sort of a brief intro from you directly to our patients before they start seeing you in the exam room at the clinic. Thanks for taking the time tonight and introducing yourself and talking candidly to the iLabs team. And we welcome you, and we look forward to having you grow with us. And to our patients that are watching, each and every one of you, thank you for taking the time. And stay tuned for more iLabs video blog coming to you monthly on various topics like eye disease, eye care, and anything that we find interesting that you may want to know. So thanks for tuning in, and we'll talk to you later. See you later, Faran.
Thanks a lot, Richard.